So Botox can be injected into multiple different areas on the face, targeting specific muscles. Some of the most common areas that I treat are the frontalis muscle, which is the forehead, the glabellar region, where we treat the procerus muscle, that's kind of like right on the bridge of the nose, and the corrugator muscles, which are very small muscles that kind of bring your eyebrow down. And what that creates most commonly is the 11 lines that patients complain about. The other area that's really common to treat is kind of right on the side of the eye, and that's where most patients complain of crow's feet, these little kind of wrinkles and fine lines. I would say those are probably the three most common areas that I inject Botox. The 11 lines that are kind of commonly termed, patients come in and when they kind of frown, they have two wrinkles or fine lines in between their eyebrows. And what that is there's a muscle on each side named the corrugator, and when that muscle is kind of activated, it gives you these kind of two fine lines. So by targeting those muscles to relax, we get rid of those fine lines when patients are frowning or making facial expressions. So the most common injection points in my practice are the forehead, which is the frontalis muscle, the glabellar region, which is in between the eyebrows. That includes the procerus muscle and the corrugator muscle. And then the third area is kind of on the side of the eyes, that when you smile, you have these little fine lines that people commonly refer to as crow's feet. That's another very common area that I treat with Botox. The procedure of injecting Botox is not exactly the same for each specific area of the face, because each muscle requires a specific number of units to relax that muscle. So it's really important to go to somebody who knows exactly how many units they want to use for each specific muscle to get the ideal aesthetic result.